My story starts off in the early 90s when I met my husband Andy here in Berkeley, and everything was wonderful for like the first 10 years. In 2004, after Andy got diagnosed with Lewy body disease, Lewy body is a dementia much like Alzheimer's, where the person loses their memory and basically forgets how to do like daily activities. And so in 2004, I had to make the choice between continuing to live and work in LA and keeping my health insurance, or coming back to Berkeley to become his caregiver. And naturally, I chose the second. And I tried to plan ahead, and I put myself on his health insurance plan. And so what a lot of people don't realize is that your health insurance may cover yourself, but if you're trying to cover your spouse and your kids, the premium still gets taken out of your paycheck. So my being on Andy's health insurance was still costing us like $400 a month. But this arrangement worked for a while. But as Andy's disease got worse, we started going through our money faster. I had to pay for adult daycare. I had to pay for other caregivers to come in and help. So at that point, I was faced with another decision, whether to keep myself on his healthcare plan for $400 a month, or to save that money for his long-term care. And honestly, I really didn't know how long he would live. It could have been another 10 years, and we would have had to pay for an assisted living facility. And those cost like a ridiculous amount of money. So again, at that point, I chose his care over myself, and I went off of his plan. So we fast forward to March of this year. In Andy's condition, suddenly it's like he falls off a cliff, and he was in hospice for 8 days and then died. So then I get a letter in the mail, along with all the other bills one gets when someone dies, that my own health insurance plan has lapsed because I didn't meet the $30,000 a year minimum. I'm basically saying that if America had a public health option, Americans like myself would not have to choose between paying for health care insurance and being a caregiver.